everybody. I'm Greg Stock, CEO of Thibodaux Regional Health System. Today it's my pleasure to introduce Dr. Trevor Johnson. Dr. Johnson is a pain specialist, MD. We're going to let him tell us a little bit about his education here in a minute, and a little bit about where you're from. You want to do that, Dr.
Sure.
Johnson?
Yeah, so born and raised in New Orleans, Louisiana, specifically the West Bank. I went to Jesuit High School for my high school education, went up to LSU for undergrad where I got a Bachelor's of Science in psychiatry. Ended up doing my medical school up in Arkansas. Came back home to complete my anesthesia residency at Oshner Medical Center. My last year as a resident there, I served as chief resident, which was really awesome. Ended up going to do an additional year of training to specialize in interventional pain management. And so I did my fellowship back up in Arkansas, and now I'm back here.
That's awesome. Great to have you.
Oh, same here. Happy to be here.
Coming. Recently joined our staff, was practicing full-time here. So Dr. Johnson, just for a moment or two, you went to medical school, then you did a residency in anesthesia, which is great training.
Correct.
And you went to some great programs, but then you went back and did what we call fellowship, right? More training in pain management. And so why don't you talk for a moment or two how you feel your training has prepared you to take care of people that have pain problems?
Sure. So I think the biggest swing in pain management over the last 10 years or so has been the transition to what's called interventional pain management, meaning we're not throwing hard narcotics or opiates at patients anymore. We want to really see if we can target that pain. And I'd say that's what my fellowship really specialized in, is those interventions. What procedures can we do to restore that functionality in our patients who are hurting and have plenty of reasons to be hurting?
And some of these things evolved where it's almost like a little small miracle. Some people, a big miracle when that pain goes away. But it happens on the spot almost, right?
Definitely. And that's kind of my favorite thing with pain management is getting that instant gratification of, wow, this person came to me not broken, but hurting, and I was able to quickly remedy that pain. And it's just kind of really fulfilling, fills my cup up, you know?
That's awesome. That's awesome. And that's a great thing, that your purpose as a young physician is to really help people live more of a full life, complete life, a robust life if they can. People are living longer and they still like to play sports and do different activities,
Lots of
right?
pickleball.
Spend time with their families.
Yes, sir.
Let's talk for a second or two, though, about someone who maybe hurt their shoulder playing football in high school, or playing soccer, they hurt their ankle or whatever it was, and they kind of living with it. But they're 40 years old and they still want to play some sport, pickleball or whatever it is, and it's painful to them. In a general sense, how can you help them?
Sure. I think a big thing that we focus on in the pain world is how can we prevent these patients from having to get that total shoulder replacement or total knee replacement. If we can do these minimally invasive procedures to at least prolong that course until they get that repair or a replacement, that's kind of our goal. So specifically with knees, if a patient has really bad osteoarthritis of the knee, bone on bone, probably need a replacement, but just not there yet in terms of their lifestyle. Yeah. I think we have plenty to offer in terms of joint injections or radiofrequency ablation, fancy word for nerve burns, kind of different modalities to treat different knee pain, joint pain. Pretty much the majority of pain that people have, there's usually something we can do to help out.
I love it, love it. So it just makes the journey a little more tolerable when you have pain, right?
Definitely.
So many different people have so many different types of pain, back pain, neck pain, whatever. And so you pretty much treat all of it, though. I'm not sure there isn't anything that you haven't been trained to.
Correct. If there's something in terms of chronic pain, if there is a nerve or anything that I can target, there's usually something that we can do for it.
I love it. I love it. Well, we want to welcome you to town again, Dr. Johnson. It's great having you. Great young man. Very well trained and real great addition to our medical staff.
Oh, happy to be here, of course.